Services Academy, as you see the name, it doesn't look like a university, but when I'll tell you why we call it like this, it is the history. So this academy was created when all other academies were being strengthened, like the Civil Service Academy, the Judicial Academies, the Military Academy. So they were all there already. So in health, there was a need of development and improving the capacity building of all health workforce, not just doctors. So the basic aim of this academy was to train people in various aspects of health, including doctors, nurses, paramedics, and of course allied health staff. And initially, pharmacy and pharmacists were not initially in 1988. Later on, when we went to the Kadism University, we got affiliation. So we shortlisted pharmacy, B pharmacy, and PharmD students for our trainings as well. So now a big proportion of public health alumni in Pakistan are PharmD. So you can say there is a contribution of Health Services Academy in public health pharmacy of the country, and they are all awaiting guidance and future. You can see opportunities, and they are very skilled, and they are and many are already contributing. In 2002, the academy was so initially it was a department of the Ministry of Health. In 2002, it was given autonomy, and in 2018, it was given a university status. We called it as a degree awarding institute, and ultimately we became degree awarding institute. And since 2020, it's all functioning as a degree awarding institute. This was the old building into 1988. It was started in a blue area. You can say a shopping plaza or an apartment or sort of a plaza. Bevel Plaza it used to call. So this was 2 floors of the plaza were with Health Services Academy. And in 1988, we started at these 2 floors, and in 2006, we shifted to a very nicely purpose-built. So this is a picture of 2006. Now it is all, you can say, is a jungle over there. Too many trees, and Zulfikar has seen it. So it is now different. Since 2006, we shifted into this building. It has multiple blocks, administrative, faculty, and academic blocks, and management, and we are catering to a lot of students. These 3 areas, I will not read all of it. I'll just tell you that there are 3 areas for which are mandated by the Act of Parliament of the Government of Pakistan to governments. This university, it's a public sector university, it's a government university, but it is quite an independent organization. So Act of Parliament has given us to do the training of all sort of training, if you can see, even the animal sciences. So we are thinking of starting some phase 1 trials as well, phase 1, phase 2, phase 3. So there is a separate department which is working on clinical trials, inshallah, hopefully soon, within next year, we will be having some clinical trials. We were part of those these COVID vaccine trials and seroprevalence studies, but we want a better role in the future. Biotechnology, pharmacy, and all allied. We can hold exam, we can issue degrees and certificates and diplomas, and the third role is policy advice to the government. So whenever there is a policy question in Pakistan, Health Services Academy is one of the think tank or one of the policy unit for any policy question in COVID or in pharmacy. So we are member in DRAP. We are member in all other union, all other councils and all other things. So this is something which is good for us. Objective I already mentioned: training, research, and ultimately evidence-based policies and practices. This is our academic portfolio. This is what I wanted to show you. We started with a 1-year MPS program in 1996, which was converted into 2-year MS in public health, because in 2007 HEC shifted to BS and MS type degrees, where PharmD was also introduced. So we shifted to a 2-year MS in public health program in 2007, and since then it is like this. We have a fellowship, College of Physician and Surgeon Fellowship in Community Medicine. We have a PhD in Public Health, and 2 of the first batch in which we inducted 5 PhD students. Out of those 5 PhD students, 2 were pharmacists. So you can imagine there is quite a number of alliance association with pharmacists in Pakistan. We also started this master's. This is also a master's in health economics and management. This is a master's in MS in disease vector control, especially for dengue and leishmaniasis. We have a master's in human resources in health program in collaboration with Queen Margaret And all of these programs can be done by your pharmacy alumni. All the pharmacy students are eligible for all of these above. Family medicine exclusively for medical doctors, but it also has a lot of spaces for nurses and pharmacists. Pakistan is expanding on Sehat program, health insurance program. So we have a diploma in health insurance program 2020. We have trained 3 batches, and now this year we will be having a 4th batch. ICU care training, it was the need in COVID, everybody was worried about the poor ICU care which Pakistan has. So we started this program with People's University of Hong Kong, and in that we trained many people. I'll show you the later on. Hospital management program is there. There's a diploma. There's a certificate. There are online diplomas, multiple, and you can go to website and you can see. Recently, this various aspects of pharmacy, we have started these programs, and we will add on through your advice and contribution. All of you are always welcome to visit HSA and to call me or any other faculty in HSA and seek guidance in any of the programs. And we also want to do some research through DRAP, through PPMA and all other. The next year, we are thinking of developing these biotechnology and biomedical sciences subjects, and we are working on that. Mission statement, very simple, internationally recognized center of excellence. We already have a special batch of Afghan students doing MPH in HSA. So the moment Afghan, US forces got out of Afghanistan, we had inducted in July a special batch of Afghan doctors who are doing MSc Public Health on campus inside Health Services Academy. And more are coming. They are at the border. There's an issue over there. So they will be quarantined and they will join this. And we are working with ComStack. So ComStack is taking us to African nations, African countries. We are trying to work with 28 African nations who are members of the ComStack, and we will be opening campuses over there. We have a lot of discussion with Sri Lanka, with Nepal, institutes of public health. We already have, I'll show you the linkages which we have with other institutes. We have a Senate, we have a syndicate, and we have an academic council. This is the president of Pakistan is the chairman of our governing structure. So he is the head of Senate of Health Services Academy. So you can see the highest level office of Pakistan has a linkage with the Health Services Academy. So I'm Vice Chancellor and I report to the President of Pakistan as a Chancellor. He's the Chancellor of Health Services Academy. These are just to show you the full-time faculty. This is the full-time regular faculty of HSA. We have 5 professors and all of them are PhD. We have 8 professors, out of them 1 associate professor, out of them only 1 is MRCGP from UK and 1 is FCPS, other 6 are PhDs. We have 10 assistant professors, all PhD, including 1 FCPS and 1 MRCP. All of our lectures, they are MPhil and MS in various disciplines. And by the way, we have one of the faculty with us, associate professor. He is an alumni of, he's a pharmacist. He's a member of the vaccine committee of Pakistan for COVID because HSA contributed in all these vaccine strategies and vaccine guidelines and COVID guidelines. And he is an alumni of MIT Harvard, and he did his PhD from a joint program from the Singapore National University and Harvard. So you can see we have a very able faculty of pharmaceuticals as well, pharmacy as well. I told you health policy development, COVID response. We trained 10,000 health professionals in COVID care, PPEs, 100,000 healthcare workers. They were in-service trainings regularly done in all parts of the countries, and we have all the data, and we are doing a lot of publications on that as well. We have established a global health department through which we will be reaching into various parts of the world. The University of Manitoba, Canada has already joined HSA, and their office is inside Health Services Academy. Zulfikar has seen that we have a global health department, and we will use this global health department for our expansion in the international level through you can see partners. Health insurance management collaboration, there is a lot of international national collaboration. All the universities are linked with an MOU with Health Services Academy, and we have a faculty and student exchange. Look at this. With Cambridge University for Bradford, Manitoba University, India, Canada, Chinese University, Hong Kong, University of Washington for disease control priorities and essential health service package, Heidelberg University, Gates Institute, University of Gadamada University, Indonesia, and Cambridge and Tehran University is in the pipeline. So we have a lot of international collaboration, and I just mentioned a few which are currently active and these are the development projects through PC1 funding national and national bodies. This is also development projects, the registry, the healthcare worker, the UHC package, the countdown of MNC, prevalence of COVID-19. We did 3 surveys. Now the important part is at the bottom. You see 5% finances is coming from government of Pakistan. So we are on the government of Pakistan for our function. This is very independent university. The financing is not dependent on HEC or is not dependent on, we haven't taken any money from HEC as yet since 2018, and we haven't taken much money from the government of Pakistan as well. So if you can say 200 million if is the budget of some of the main activities, core activities of HSA. So out of those, only 10 million will be coming from government of Pakistan. So this is something which we are a revenue generating institute. This is just to show you that last year, just in 1 year, over faculty on the left side in orange, 36 international publications were done, and it is not a number which any other government institutes has done in 1 year, and that is too in the COVID time. Production of MS and PhD you can see on the right side. Currently we are having 239 PhD or MS MPhil students on campus. So you can imagine that the campus has a potential. We have 7 lecture rooms. You can always visit there, all air conditioned and all linked with multimedia and a lot of other support. Being a government, it is very difficult to maintain, but still we have done them, and the whole campus is Wi-Fi, and you can do online, and you can also do physical on. We are the only institute in Pakistan to host this Journal of Public Health in Pakistan. This is indexed at HEC as a Y category and also recognized by Pakistan Medical Commission. And we are now going towards this, you can say, PubMed and impact factor for the next year, inshallah. This is our outreach strategy. We are using a multiple channel approach. We are entering into a corporate social responsibility with pharmaceuticals. We are giving them space and place for research. We have an ORIC, Office of Research, Innovation and Commercialization. So we are very open to all the pharmaceutical industry. Unlike all other health institutes, I have a very different mindset. I said that if they are there as a corporate, as a business, but I think they are also sort of sympathetic for a lot of corporate sector and social sector contribution. So we can use them in our research, in our sort of projects which can benefit the poor actually. So we are open for those partnerships internationally and nationally, and there are so many things in the pipeline. On the 23rd and 24th September, we are holding a very big conference in Pakistan, and it's happening physical. Online also you can join, but physically you must join. This is the Access to Medicine conference. So this conference theme is access to medicine and access to technology, and we are partnering with a lot of institutes. This is something a way forward. I already mentioned you more departments, more trainings and more things. This is the Chancellor. Last week, we presented the President of Pakistan, the 5-year plan of Health Services Academy. It was approved at the President House, and we are moving fast towards implementation of this plan. This is the Health Minister and the Parliamentary Secretary for Health. This is the NIH head, General Amir Ikram, the DG of KP, Janbaz Afridi, and General Salahuddin Qasim, who's the head of the Board of Governor. This is WHO head, this is DHO, and you can see the DG KP. DHO, and this is the NCOC presence. We are there daily, and we can participate at the highest level in Pakistan. There are only a few. I can name 4 or 5 people who are there from the civilian side, and we have partnered with them, and we do a lot of contribution in development of COVID response. And Pakistan so far, alhamdulillah, had been quite good. Currently, we are facing from a very bad patch. The hospitals are full, and there is a very huge surge of sort of COVID in Punjab and in KP. It's eased off a little bit in Karachi, but the rest of the country, especially Punjab and KP, is suffering, and we are daily meeting and trying to combat that. This is DRAP. You can see the above picture. The DRAP team came here and we discussed on clinical trials and a lot of other areas. We also work with the population welfare, and we also work with a lot of institutes like Bill Melinda Gates and Clinton Global Initiative and all these institutes. This is HEC. General Asif and Chauhan Saab is in HEC. General Shahab is in office. This is Health Minister and Parliamentary Secretary. You can see the Pakistan Medical Commission head Ashad Taqi Saab, along with Brigadier Nasir, who is the member licensing. This is a group of Balochistan. We are opening a campus in Balochistan as well. So I'm moving in the first week of September to Balochistan, meeting with the CM of Balochistan, and we will try to develop a lot of infrastructure and other things in Gwadar, in all other Baloch areas as well as Pashtun areas of Balochistan. We have a lot of agenda for improvement in most of the things which can be done in, and WHO head you can see in the above picture. We have a lot of collaborations with grassroots organizations. This is just one example. We have multiple NGOs working with us for community uplift. We are a member of the SUN, you can call it ScaleUp Nutrition, Civil Society Alliance, and we do a lot of working with a lot of international organizations. We have a very close linkages with Army Medical Corps, and we train their managers as well. So all the military hospitals are connected with Health Services Academy. So this was Zulfikar and Farooq Saab and all other colleagues. This was a brief, you can say, I think I took some more time, but this is the first time which I was able to talk to you guys. So I think over to you, and I'm here for any questions.
I'm really grateful and excited to see Naomi today, the HSA, and I feel really proud to be part of HSA. Basically, we are representing pharmaceutical community, and seniors like Farooq Sheikhs and the, many others. Nadeem Subhani is also there. He's also a very senior person.
Yeah.
So on behalf of that, we congratulate, and I want to admire your effort, Dr. Shahzad Sahab, because I'm quite junior to you, but I have seen the way you are working and striving. It doesn't seem to be as a means government department. जस्ट एक बताने के लिए कि आज सैटरडे एंड संडे ऑफ होता है HSA का, तो सिर्फ इस एक ट्रेनिंग के लिए मुझे के लिए पूरी टीम स्टैंड बाई पे है, जनरेटर्स के लिए, नेटवर्क के लिए, IT, और मैं सिर्फ अकेला यहाँ पे बैठा हुआ, हाँ अपने छोटे बेटे को अपने साथ एक हेल्प के लिए लाया हुआ हूँ. सो ये इनका बताता है कि हाउ मच ही इज इंटरेस्टेड. अदरवाइज आई एम सॉरी, मैं शायद कोई गलत वर्ड यूज कर लूँ, कुछ और जगहों पे शायद डैम केयर एटीट्यूड जिसको हम कहते हैं, यहाँ पे ऑल केयर एटीट्यूड के साथ डॉक्टर शहजाद साहब का मैं शुक्रिया अदा करना चाहता हूँ बिहाफ. और सर मैं थोड़ा सा ज्यादा आई वांट टू रियली थैंकफुल, और यहाँ पे मैं फार्मा कम्युनिटी को भी बहुत बहुत शुक्रिया शहजाद साहब, और फार्मा कम्युनिटी को भी. अब ये देखिए एक कॉन्फिडेंस, अगर हम शॉर्ट कोर्सेज यहाँ से करते हैं हेल्थ सर्विसेज एकेडमी से, नंबर 1 सर्टिफिकेशन स्ट्रांग है, आप लोगों ने खुद ही प्रेजेंटेशन में देख लिया. दूसरा प्रैक्टिकली कोर्स का कंटेंट क्या है, तो उसके लिए बस फारूक शेख साहब जैसा नाम आप लोगों के सामने है कि नाउ ही इज सुपरवाइजिंग ऑल द कोर्स ट्रेनिंग कोर्सेज. So thank you very much, Dr. Shahzad, once again, and I will move forward to next of our agenda.
I want to say a few words about the academy and Dr. Saab.
Go ahead, sir, please.
Dr. Saab, initially Mr. Zulfikar asked me for my introduction. I told him that in spite of doing my introduction, I will straight away go at. I just give you a brief introduction that I have worked with number of countries, dozen of countries rather. But the passion which you have for pharmaceutical, which is really, really appreciable. And I'm very happy to see and very glad to see that how much open and flexible you are. Let me tell you one truth, that in pharmaceutical, it is very difficult to have a platform. And I am the person who has worked for couple of countries in Europe as a leader, and for the development of even the managing directors. But I have never seen such an open environment there as well. So I congratulate you for your this spirit, sir. I really, this is a great help for the pharmaceutical, because in pharmaceutical we have this very big gap, which you and Zulfikar are trying to fill this one. Sir, thank you very much, and I salute you, sir.
Thank you. Thank you, ji.
Thank you,
We
sir.
can do a
I'm very
lot.
happy to see this one.
अब तस्वीर नजर आ रही है हमें जुल्फकार की